recognize their limitations, seek appropriate consultation, and learn from the findings and recommendations. Providing client care can become complicated when a client transfers from one nursing unit to another. This is common when the client requires a different type of medical, surgical, or critical care service. Transfer to another unit requires considerable preparation. Nurses on the sending unit coordinate activities with nurses on the receiving unit. These activities include assessing the client's stability for transfer, preparing the client's medical record, transporting medications and personal supplies, orienting the client and family to the transfer procedure, and transporting the client to the receiving unit. Before a transfer is initiated, it is critical to determine the client's physical condition. No matter which type of unit the client is transferred to, the care plan must remain current and appropriate for all team members to follow. For continuity of client care, nurses on the receiving unit must acquire complete information about the client's medical and nursing requirements. Nurses from the sending unit provide a complete report to the nurses on the receiving unit. The client's care plan may even stay the same on the receiving unit, but it is still important for the client, family, nurses, and other healthcare providers to validate it. Nurses must have a clear understanding of the client's progress and the interventions planned. After a client arrives on the receiving unit, the nursing staff is responsible for assessing the client's condition and determining whether or not revisions to the plan of care are needed. Throughout the transfer process, the client and family are kept informed to minimize their anxiety and fear. Teaching the client, family, and other caregivers is an important responsibility for all healthcare team members. The nurse has the primary responsibility for teaching the client and family about any health problems, discharge medications, procedures, anticipated restrictions, complications to inform the primary care provider about, and resources available for assistance. Other healthcare team members also contribute to client education. That includes pharmacists, dietitians, physical and occupational therapists, and respiratory therapists. It is important to have an agreed-upon plan of care so that no conflicting information is given. All healthcare team members must document any instructions provided and evaluate client understanding. This prevents duplication of efforts during the limited time available. The plan of care includes discharge planning, which must begin as early as possible in the client's stay. Nurses are involved in discharge planning because they are the healthcare providers closest to the client. Nurses are often the first ones to be aware of problems the client may encounter on discharge. And remember, consultation with other healthcare providers is a crucial component of discharge planning. In most settings, nurses work with several other types of healthcare providers. Physicians are responsible for medical diagnosis and prescription of treatment. Physician assistants work under the direction and supervision of a physician. Pharmacists are licensed to formulate and dispense medicine. The pharmacist is an excellent resource for information about new drugs and how specific medicines must be administered. The pharmacist can also help educate clients who must follow complex medication regimes. There are a variety of allied health professionals to assist you in providing client care. Physical therapists are licensed to examine, test, and treat physically disabled or handicapped clients with special exercises, heat and cold application, sonar therapy, and other modalities. Occupational therapists are licensed to recommend various adaptive devices that help chronically ill or disabled clients carry out the activities of daily living. Respiratory therapists are licensed to deliver breathing treatments to improve oxygenation. Care initiated by these therapists is often continued and evaluated by nurses. Collaboratively, nurses and other members of the healthcare team evaluate the client's progress, develop goals, and formulate discharge plans. Nurses also refer clients to social workers and work closely with them to identify resources for meeting current and future healthcare needs. Social workers provide information about resources for clients and families during severe or terminal illnesses, arrange placement in extended care facilities, and locate financial resources. Spiritual advisors offer support and guidance to clients and families. The spiritual advisor may be employed by the healthcare agency or have a religious affiliation in the community. In addition, the nurse may work with a variety of nursing personnel. Registered nurses and practical or vocational nurses are both licensed by the state in which they practice. RNs and PNs roles and activities are defined broadly by the state's Nurse Practice Act and specifically by the employing institution. Nursing assistants, aides, and technicians are trained to provide basic client care. Advanced practice nurses have educational preparation beyond the basic RN requirements and have specialized expertise and certification. Clinical nurse specialists and nurse practitioners work in ambulatory, community, or inpatient settings. Advanced practice nurses have prescriptive authority in some states. Delegation is empowering others to perform an activity or to assume a role. It does not imply giving up responsibility, however. The assignment of responsibility to a competent person who is equipped to perform the task increases job satisfaction and productivity. Delegation involves organization and supervision to maintain safety and quality. The person delegating the task retains ultimate authority and responsibility. The person accepting the task assumes accountability for the task. Clear expression of expectations and goals is essential for achieving the desired outcome. Both parties must understand the need for the task, how it will be carried out, the timeline, and the beneficial effects. Selecting the appropriate person to carry out the task is based on education, skills, experience, potential for harm, complexity of the task, critical thinking required, and the person's ability to communicate. The task must also be within the staff member's scope of practice. In delegation, the first step is to identify the task to delegate. It must be something that others can do, as defined by regulations and practice acts, standards, position descriptions, policies and procedures, organizational structure, and resources. Next, select the best person for the task. Consider the staff's education, experience, interest, and workload, as well as the amount of monitoring that will be required. Then, communicate the assignment. Directions must be clear, reasonable, and complete. If the task is detailed or complex, provide directions in writing. The appointed person needs to know what to do and to whom, the time frame, any limits on what the staff member may do, and what feedback is desired. The staff member must accept the delegated task and indicate a willingness to complete the task. For example, which pediatric client is most appropriate to assign a PN? A 5-year-old who was 5 hours post-tonsillectomy and adenoidectomy. B, a 6-year-old just diagnosed with diabetes. C, an 8-year-old who has a fractured femur with a Steinmann pin in place. Or D, a 10-year-old who has a ruptured appendix. The answer is C. A PN can monitor for infection at the pin insertion site and assist the client with basic care. The 5-year-old post-tonsillectomy could have a compromised airway, and the child with a new onset of diabetes would require a lot of new teaching. Typically, PNs do reinforcement teaching, and the client with the ruptured appendix would probably need multiple IV medications. When you delegate tasks, be sure to provide feedback and monitoring. The amount of monitoring will vary with the task, the staff member, and the situation. When something is done well, let the individual and the team know. Leave negative criticism for private discussions, and always include positive as well as negative feedback. Also remember that